some of the successes that they've basically been having and how we can essentially adapt chiropractic to fit in with many different people. Now, the conversation or the topic was pregnancy and post-birth. Now, a lot of people will start to develop problems during pregnancy. So they won't necessarily have any problems up to or during, but they may have some post. Some people may have problems before, and then they're exacerbated during pregnancy. Now, here is probably the most common dysfunction that we will see, and this is the one that generally, if you're going to go and see your GP about lower back pain during pregnancy, is something we call pelvic girdle dysfunction. Now, what we have to understand, in order to pass a baby, you have to get something the size of a watermelon through your pelvis. Now, the body is an absolutely amazing thing. But when you think about that, when you think about what has to pass through a very small object, it's actually really quite amazing. And let me just show you. So essentially, we have to get a baby through that. And what we can actually see is how the joints at the back join up and at the front join up. Now, with those joints, we can start to see a lot of problems happen. Now, when a baby starts to grow, the pelvis will start to tilt, generally in an anterior direction. And as a result, what starts to happen is the joints in the lower part of the back and around the pelvis will start to create excessive friction. Now, the reason why this seems to occur more now than ever is that prior to pregnancy, there are almost always more problems in society and in mechanics with people's bodies than what there ever has been before. So when we look at the way that people sit, when we look at the way that people live, when we look at people's diet, when we look at people's stress, there is an excess of stress already on the body. So the reality of it is that even though pregnancy seemed to be the thing that irritated people's spine, there was already a problem there prior to the pregnancy. Now, the pregnancy just exacerbates the issue. And like I say, pregnant people are absolutely no different to anyone else. Their body is working almost exactly the same. Now, the only differences that we see is in the last trimester, really in the third trimester, we start to see some big changes start to occur then. And this is where our hormone imbalances start to actually fire off. Now, the reason being is that we have to get the baby out. And as a result, what we have to do is drive certain hormones, and the main one being oxytocin, so that our ligaments can start to actually become more flexible so we can actually pass the baby out. If those hormones are not changing, the baby will not pass out and will start to have complications. But that being said, people will quite often say to me, well, how does a chiropractor adjust someone when they have a baby bump? Well, simple. We have a cushion for someone to lie on. And this cushion is adaptable. So it's got Velcro markings so that people can actually start to expand it to the size of the bump, which is brilliant. So all pregnant ladies can come, and even if this is the only benefit, come and lie down on their tummy. And amazingly, anybody that has got pelvic girdle dysfunction and is pregnant, one of the most comfortable positions you can put that person in is lying down prone on the table, because it takes all of the gravity off their spine. Because even when you're lying on your back and you've got a baby in your tummy, guess what? The baby is pushing back into the spine and it's pushing back into the pelvis. And so as a result, actually laying down on your tummy is the most comfortable position that you can get into. The last part of the topic that I wanted to discuss is post. Now, some people won't necessarily have a problem during or before, but they actually develop the issues after pregnancy. Now, what we have to understand again is that we look at the type of stress that this puts on someone's body. Now, pregnancy has almost been made a medical problem, and we started to treat it like a medical condition. And so the environment and the processes that go with this are sometimes very, very forced. And if we start to force the process, then things can start to go wrong. And like I say, even if you didn't notice an issue prior to being pregnant, if there are prior conditions, say for example, certain muscles around the pelvis are tight or weak, actually there can be complications in trying to get the baby out. And as a result, these can be exacerbated, especially when we have something like a C-section, because a C-section will start to tear certain muscles. The pregnancy process will start to tear certain muscles. It will start to strain certain ligaments, and it can start to irritate certain nerve roots. And so some of the most common symptoms I'll see after a pregnancy, stuff like sciatica, stuff like pelvic girdle, lower back pain, pubic symphysis, so the around where the front of the pelvis is, in that pubic region, we can start to get pain. Now, what we know is if the ligaments and the joints are not moving properly and they're not stable in other areas, then we can start to get friction and we start to create pain. Now, chiropractic is one of the best professions in actually being able to break down scar tissue in the joint line. And if we can break down that scar tissue, we can get the pelvis working properly and we can start to rehabilitate those functions, then people can start to heal properly and they can actually start to feel a lot better. And that is really the only purpose of chiropractic, is to actually start to encourage the body to do what it does best, which is heal from the inside out. And by doing that, we actually start to move those joints around the pelvis and actually start to get them a little bit more aligned, a little bit more functional. We can start to train the muscles around the pelvis and actually bring you back to normal function. So if you've had problems, say for example, during, post, or pre, you're thinking about having children and you're not sure whether your body is at that functional state to do so, then it's really simple. We can check during any of those phases of care. No one is excluded, and we can help you with your pain. One thing we just have to understand is that whilst you're pregnant, those stress levels on your body may well be higher and may require a little bit more TLC and care. Hopefully someone will find this helpful. If you have any specific questions, obviously please comment in the comments below. I've actually worked with tons and tons of pregnant ladies, and actually of all of the pregnant ladies I've ever worked with, only ever one has been a C-section. Only one has ever been a C-section who has gone full term through their term, for all through the trimesters to the third trimester, they've gone through chiropractic care. I've only ever had one that's had a C-section, and that was voluntary because there were such heavy complications on the first one. So actually, to be honest, getting the pelvis even just functioning enough for me appears to make the birthing process significantly simpler. And all of those patients have recovered dramatically faster on their second pregnancies after they've actually received chiropractic care than what they did a lot of the time during their first pregnancies. Hopefully this was massively helpful. If you guys have any questions, please comment. If you know someone that will benefit from this information, please share. Like I said, we have got the resources and tools to see a multitude of different patients in the clinic. So hopefully, like I say, this can be really, really helpful for you. Take care until tomorrow, and we'll speak to you again soon.